Okay, hello everyone. Today we will discuss 10 mnemonics. We will discuss 10 mnemonics today. So first mnemonic, I will want to tell you about homocystinuria versus Marfan. Homocystinuria versus Marfan. I'll only tell about the lens dislocation, how you'll remember it. So the best mnemonic for this is M. You look at the direction of the horns here. It is upwards and outwards. Upwards and outwards. So that is superior and temporal dislocation of the lens is seen in Marfan's. Opposite will be seen in homocystinuria. Okay. Now, another mnemonic, we will talk about the drugs which cause a drug-induced lupus. Drug-induced lupus or drugs which are metabolized by acetylation. So the mnemonic is SHIP, and maybe you can add D also. So S is sulfonamide, sulfonamides. D stands for dapsone. Actually, dapsone is also a category of sulfonamide. So you can simply remember it as D. Sorry, SHIP without the D. H is hydralazine. I is isoniazid, and P is prokenamide. See, this is the tricky point. Most people will think P is propranolol, P is so and so, a lot of things, but no, P is prokenamide. So this is another mnemonic I wanted to tell you. Okay, what other mnemonic? Now I can tell you also about X-linked dominant condition. X-linked dominant condition is Ravi. R is Rett syndrome. Rett syndrome is what? Can you tell me? Rett syndrome is autism spectrum disorder. In this, there will be a girl child who is after 6 months of age. She would be developing normally till 6 months. After that, she will show regression in her motor milestone. She will show stereotypical movement. She will be doing something with her hands or legs. So that is one thing. And she will be like mentally abnormal, some kind of retarded behavior. So that is the Rett syndrome. Okay, A stands for Alport syndrome. Alport syndrome you have studied in kidney, Alport syndrome. And V is vitamin D dependent rickets or hypophosphatemic rickets. A question can come here, what is the gene involved? It is the FEX gene, PHEX FEX gene. I stands for Incontinentia pigmenti. Incontinentia pigmenti is a lack of pigmentation. Along which lines? This is the MCQ question. Along the Blaschko's lines. Blaschko's lines. So Blaschko's lines are actually, they are the lines of epidermal cell migration. They are the lines of epidermal cell migration. Anyway, this is the question which will come here. AML. Okay. So AML will have a lot of categories. AML, like we can start from M0 to M1, M2, M3, M4, M5. Up to you have M6 and M7. M7 is the megakaryocytic leukemia. Okay, so see, obviously I don't have mnemonics for everyone, but the most common question which comes here is, they ask you chloroma, eyes, there will be green, you will have greenish eyes. So chloroma, this is chloroma of the eyes. This is seen in M2. What is the mnemonic? Eyes. You have two eyes, so it is M2. Two eyes, right? You have two eyes and you have M2, right? Okay. I don't have any other mnemonic here, but I would like you to know all the details which can come here. The most common type of leukemia is what? AML. This most common type of AML is what? M2. This is the most common type of AML. Okay, where will you find Auer rods? Auer rods are found in which kind of AML? It is seen in M3. M3 you will find Auer rods. What else will you find in M3? You will also find DIC. Will find DIC. And what is the treatment of this M3? Vitamin A. Vitamin A is the treatment of M3. M4. What is the specialty of M4? M4 has leukemia cutis. What is M5? M5 is associated with gum hypertrophy. Right. M6 is associated with what? It has nothing special. It is not anything special, but you can remember it is also known as D. Guglielmo disease. D. Guglielmo disease. M7 is of course megakaryocytic, and this is the most common leukemia which will be seen in a child with Downs who is less than 2 years of age. And also in this M7, another specialty is you will find dry tap on bone marrow aspiration. There is always translocation. Most of the leukemia you will find translocation of something. Inversion is seen in which one? Which among these will show inversion of chromosome 16? Inversion. 4 4s are 16. Some kind of matching, right? So inversion will come in M4. Now, this is AML, which means it's a myelogenous leukemia. So AML, myelogenous, which means you have to stain for myeloblast, right? If you stain for myeloblast, it will come positive. So what are the stains for myeloblast? Can anyone tell me? Of course, myeloblast myeloperoxidase, MPO, and then you have neuron-specific enolase and also PAS. About Fregoli versus Capgras. This is, you have studied it in Psychiatric, Fregoli versus Capgras syndrome. So this thing, it is about a man who takes a familiar person to be a stranger, or considers a stranger to be a familiar person. So that is Fregoli and Capgras. So which is which? So cap. Imagine if someone you know wears a cap, you cannot recognize him. You will think he's a stranger. So Capgras is when you think that a familiar person is looking like a stranger, then that is Capgras. And Fregoli is the opposite. A stranger will look to you like he is a familiar person. Let's go towards ETC. So ETC, how many complexes do you have? You actually have 4 complexes, but sometimes ATP synthase, some people call it as complex 5. So you have 5 complexes in that way. 1, 2, 3, 4 and 5. 5 is which? 5 is the ATP synthase. Okay, so we will discuss the ATC inhibitors. Okay, the first mnemonic which I want to give you is that 1, O for 1. This is 1. So anything which ends with 1 is a complex 1 inhibitor, like say rotenone, phenobarbital, thiopentone, or thiopental is also, you can convert this word aldehyde, you can also write it as a ketone, thiopentone, phenobarbital. Okay, so that is 1 is 1. Next you have complex number 2. So what are the inhibitors of complex number 2? In complex 2 you have to remember it because there are only 2 inhibitors. You will have malonate and there is another one called carboxin. Okay, why malonate? Because there's a simple logic, because complex 2 is succinate dehydrogenase, and you know that succinate dehydrogenase is inhibited by what? Malonate. So basically when you're talking about complex 2, you are talking about SDH, right? Achha, now some people will ask me, okay ma'am, I know this is not important, but still, can you tell me what is the name of complex 1? So complex 1 is NADH coenzyme Q oxidoreductase. NADH coenzyme Q oxidoreductase. Okay, no one will ask you that, but this can be a question because it's such a common sense thing to tell that complex 3 succinate dehydrogenase is inhibited by malonase and carboxin. The next one is complex 3. How you will remember complex 3? The only question which comes from complex 3 is antimycin, and this thing you will remember like this. You will remember it as anthromycin. Okay, remember it as anthromycin. Okay, so this is the question which comes. But just for your common sense, there are some other inhibitors too. You have this BAL, dimercaprol. These antidotes for poisoning you have studied in FMT, they are also for complex 3. Now complex 4. Complex 4 is everything which ends with IDE, cyanide, right? Cyanide, H2S. H2S is what? This is the hydrogen sulfide, right? Hydrogen sulfide. Then you have carbon monoxide, CO, carbon monoxide, right? This thing. Now, complex 5 is ATP synthase. So, what are the inhibitors of ATP synthase? See, this is actually a tricky question. If you just want to remember simply, I can give you 2 names. One is ATP, say atractyloside, and another one will be oligomycin. 2. These 2 are complex 5 inhibitors, but there is a small difference between them. That is, oligomycin is the actual ATP synthase inhibitor, oligomycin, but atractyloside is what? It is a ATP transporter inhibitor. Atractyloside, ATP transporter. Okay, so this is the ATP transporter inhibitor. So if there is a question which is the inhibitor of complex 5, and then there are 4 options, out of which you get 2 options like atractyloside and oligomycin, which one will you write? You will write oligomycin because it is the actual ATP synthase inhibitor, right? About the Child-Pugh score. There is a Child-Pugh score for liver transplant. Based on this, you can classify how severe is the liver disease, and the more score you have, the more is your chance you will get organ donated sooner. So Child-Pugh score is, the mnemonic will be child says a बाप. Okay, child किसको बुलाता है? बाप को. तो child says a बाप. E is encephalopathy. Okay, E is encephalopathy. B is bilirubin. A is ascites. Another A will be albumin, and P will be prothrombin time. Okay. Now listen, this is the only thing which you get. It will ask you which of these four options is not included in the Child-Pugh score. But if you want to know more, then you can remember, if the child is 5 or 6, then it is not that severe. If it is 7, 8 or 9, 7 to 9, then it is a moderately severe liver disease. And if it is more than equal to 10, then it is a severe liver disease. So obviously the ones which are having more than equal to 10 will be considered first for transplant. Now see, the point is, you cannot remember this thing, but you can remember key 2-digit. If you have a 2-digit Child-Pugh score, then it is a severe disease. Okay. Remember. Also nowadays they have added a new criteria in some organizations. They have added if the person is a female, then she will be prioritized first for liver transplant. If two people one is a man and a woman and both are having the equal score, then the female will be preferred to be given transplant first. Okay. Okay, next we can talk about the Schistosoma eggs. This is a very important question, it often comes. So there are 3 types of Schistosoma eggs. One is this lateral spine, another will be nothing, goal, another one will be what? Terminal spine. Lateral spine, no spine, and terminal spine. So first thing, goal. On seeing this round egg, can you think of laughing Buddha? What comes to your mind? Some golu molu person, someone very chubby and round face. So laughing Buddha, you think of Japan. Okay, so this will be Schistosoma japonicum. And Japanese people, they have everything very nice, infrastructure, everything, they are very superior. So this Schistosoma japonicum lives in the superior mesenteric plexus. But sometimes, to confuse you, instead of giving the plexus, they will write ileocecal junction. It is one and the same thing, don't get confused. Okay, next, this thing, teda, lateral spine, it's teda, like bent. So this is Schistosoma mansoni. So from Sony, you remember Sony is a girl, and women are very teda people, they are not so straight. So mansoni, so it will have a teda spine and superior. So this you just it is inferior, and teda people are not good people, they are inferior, right? Complicated. Inferior mesenteric plexus. And like this is ileocecal junction, like that, to confuse you here, they might give you something about rectosigmoid or something like that. Okay, rectosigmoid junction or something they can give you. And the final one, this one jo bach gaya, wo hai hematobium, Schistosoma hematobium. So hematobium, this lives in the urinary bladder, and it causes what kind of cancer? Squamous or adeno? Come on, or transitional? This causes squamous cell carcinoma of the urinary bladder. Now, transitional cell cancer of urinary bladder, TCC. Then you have squamous cell cancer and you have adenocarcinoma. Which one is which one? So as we studied just now, Schistosoma is squamous. S for S. Also S for another S, stone. If you have urinary bladder stone, you have the risk of squamous cell cancer. So S, S and S. Adenocarcinoma develops with the developmental anomalies, like you say ectopia vesicae, or you have this persistent urachus, then you have adenocarcinoma. And transitional cell cancer will develop with the normal carcinogens which we have. So someone is smoking, someone is exposed to textiles, dyes, those kind of things. Cyclophosphamide. Well, usually when we think of carcinogen, we think of these kind of things, right? Some dye, some smoking, some kind of cancer drug, something like that. So these kind of things, they will give rise to transitional cell cancer. Squamous will be SSS, schistosoma stones, and adenocarcinoma will be by ectopia vesicae and urachus. You can see all these are vowels, A, E, I, O, U, kind of. So UNICEF GOBI-FFF. Okay, this is actually a mnemonic. But anyway, so GOBI-FFF everyone knows, but what I want to tell you is that, can you tell me what is there in GOBI-FFF? G is what? G is for growth monitoring. O is for oral rehydration. B is for breastfeeding. I is for immunization. And F is for family planning. Another F is for food supplementation. And another F is for female education. Food supplementation, they will give you so many options, and one of them they will write food fortification or something like that. So then you will get confused. You will mark it ki haan ye to hai food fortification sir, but no, remember this food supplementation, it is not food fortification. Okay.